Hello, I'm Dr. Andrew Neville. I want to talk to you a little bit about vitamin C today. Vitamin C is absolutely crucial for everyone. Everyone. Like, yes, it's important for people with adrenal problems, and I'll talk about why, right? I mean, that's what I specialize in is adrenal fatigue. I use vitamin C as much as possible in all of my patients, but it's literally important for the entire population because we're one of the only mammals that actually doesn't make vitamin C on demand. So vitamin C chemically is this chemical called ascorbic acid. It's a very, very basic molecule, very similar structurally to glucose, used throughout the body. All cells will utilize ascorbic acid. Well, somehow humans and primates, some guinea pig and some kind of a fruit bat, I think, we lost the ability to make ascorbic acid on demand. Every other mammal can. And when we test those mammals, when you stress them, they will crank up their production of ascorbic acid primarily because it's one of the primary antioxidants in our body. And the metabolic exhaust of stress, right, of a threat, right, like fighting a tiger, the metabolic exhaust are free radicals, right, what we call oxidative stress, which then those free radicals need to be quenched. That's why we need all these antioxidants to quench those free radicals. Because they're like pinballs in an old school pinball machine, bouncing around, nicking things and damaging organs. And they exist in the blood, these free radicals, and the blood goes everywhere. So the damage from chronic stress over time is literally everywhere, head to toe, inside and out. Ascorbic acid or vitamin C is absolutely one of the key antioxidants that is needed to be able to quench these free radicals. Chronic stress over time, of course, depletes our ascorbic acid levels. Now, as humans, we can't make it, right? Mammals make it on demand. We think there was some genetic glitch a long time ago where we lost the ability to make it. We survived because we live closer to the equator. There's lots of foods that have ascorbic acid in it, right? So we can now get it in our diet. And in fact, it's absolutely essential that we get it in our diet. But no matter how much orange juice you can drink and lemons you can squeeze and do all, like, it's hard to get enough vitamin C or ascorbic acid in our body to be able to make up for that deficiency, since we all live in a pretty stressful, fast-paced, kind of loud and toxic and sometimes obnoxious world. So that puts so much demand on our antioxidant status. Now, I talk about vitamin C and ascorbic acid. I use the names interchangeably. Yes, it exists in nature, but really it's the chemical ascorbic acid that is important, right? And when you're using it supplementally, you can use plain old ascorbic acid. Linus Pauling was one of the geniuses that did all this work on ascorbic acid, Nobel Prize, the whole thing. He used the cheapest form of ascorbic acid you could get, not these fancy Whole Foods vitamin C things that some people recommend. It's not necessary. Now, you could buffer your ascorbic acid, buffered C, which is really just binds the ascorbic acid to a mineral. Some people don't tolerate, their stomach doesn't tolerate the ascorbic acid as well, so we can use a buffer, calcium, magnesium, sodium, one of those things. You can also get vitamin C with bioflavonoids, which is reasonable. It's not essential, but it's reasonable. They exist together, and they're also antioxidants as well. Anybody who's got problems, well, like I said earlier, anybody needs additional vitamin C. But if somebody's got adrenal fatigue, you are going to be extra deficient in vitamin C or ascorbic acid, so we need to supplement. The RDA is incredibly low. The RDA was 60 milligrams. They just decided to double it, I don't know, a few years back to 120 milligrams, still incredibly low. Vitamin C is extremely safe, non-toxic. There is no toxic dose. If you take too much vitamin C, it'll loosen your stool. So then you know you took too much. But it's only taking too much at one time. Like, you might take 2,000 milligrams at one time, loosens your stool, but you could take 1,000 milligrams every hour that whole day, no problem. And if you can take that much, you should take that much. On average, probably my patients take 3,000 to 5,000 a day, but sometimes more, and it's not a problem. If you tolerate more, you absolutely want to take more. Vitamin C is crucial for really for the entire body as far as these symptoms go. specifics go towards, atherosclerosis and cognitive health, that antioxidant status, immune support and immune balance, but even connective tissue integrity, lots of different things. And when we're depleted, our body literally falls apart over time. So get your vitamin C. All my best.